Okay, everybody, we are now going to demonstrate the liver protocol. So I'm going to be explaining as we go through what I'm doing. So again, like we started a lot of exams, I'm going to start sagittal at the xiphoid process with my indicator towards my patient's head. And I'm going to look at my screen and adjust my settings where I feel like I like it. My first image is liver, sag, left, and this is the image that is going to include the aorta. Take a breath in, please, and hold it. So I'm midline at the xiphoid. I'm going to sweep all the way out of the left lobe of the liver by scanning towards my patient's left, and then I'm going to come back in, and I'm looking at the liver, and then as soon as I see my aorta come in, I'm going to freeze it. Breathe. Okay, liver sag left. My next image is going to be, again, liver sag left, but this time it will include the caudate lobe. Remember that the caudate lobe is separated from the left lobe by the ligamentum venosum. So we're going to be looking for that ligament in the caudate. Take another breath in, please. So again, I'm going to sweep out of the left lobe of the liver and then start coming back into it. Here's my aorta. I'm going to keep coming over towards the patient's right, and here I can see, breathe, caudate lobe separated from the left lobe by the ligamentum venosum. That's my second image. And I'm going to change my label to liver sag right, which is now going to include the IVC. Take another breath in, please. So I'm going to start over, sweep out towards the left, start coming back into the liver. There's my aorta, there's my caudate, keep going towards my patient's right, and there is my IVC. Breathe. Adjust my TGCs a little bit. Okay, my next image is going to include the main lobar fissure. So since I'm going more into the right lobe of the liver, which is much larger, I'm going to immediately increase my depth. Take a breath in, please, again. I'm still in the same spot, right? But now I'm going to start following the curve of the ribs down. So now I can see more of my right lobe, and here's my right portal vein. So that is a good landmark for finding your main lobar fissure. So if I follow my right portal vein and tweak my probe a bit to where I can see my gallbladder coming in, so all I did was kind of fan out the inferior, the bottom part of the probe. So now I have my portal vein and my gallbladder in one shot, and that is where the main lobar fissure is. Sorry, go ahead, breathe when you have to, and then take another breath in when you're ready. So I'm going to try to include as much of the right lobe as I can, as well as the main lobar fissure. Breathe. So I don't have to have a perfect gallbladder and a perfect fissure. What I'm focusing on is liver for this protocol. So I have a lot of my liver here, and this is the area that I'm focusing on. So I'm going to take that picture. All right. My next picture is going to be dome of the liver. Take another breath in when you're ready. So now I'm going to come down more inferior from the main lobar fissure and get as much of my dome in as I can. I made a mistake. The next one is the one with the kidney and the dome. That's okay. We're going to go back one step. My next image is technically the kidney and liver interface. So again, let me main lobar fissure, come down a little bit, bring in my kidney and my liver. Breathe. And again, I'm focusing mostly on liver, so I have as much of that right lobe as I can, but I'm showing this interface here. So for a couple reasons, we're going to look at Morrison's pouch here, which is that potential space. Make sure that there's no free fluid between these two structures. And then we're also comparing the echogenicity of the liver to the right kidney. And then my next image is going to be dome. Take another breath in. So I'm going to come away from the kidney for this one and try to get as much of the liver as I can. So I'm going to sweep all the way out to the diaphragm, then come back in and try to just catch as much liver as I can. And that looks pretty good to me. So that's going to be my dome. And then I'm going to measure the liver. So what I was doing was I started at xiphoid, and I started coming down this way for all my sagittal pictures. But when I go to my measurement, I'm going to straighten out my probe so I'm more sagittal. Take another breath in when you're ready. So in this view, now you can see the tip and the dome. So if I go back to following my ribs, you're gonna see how it's very rounded. But if I go, sorry, here's the rounded area. If I straighten out my probe, now you're gonna see tip to dome. Breathe. I'm not loving that one. Let's do it one more time. Another breath in when you're ready. So I didn't like the shadowing that was getting in the way, so I adjusted my window a little bit. I came a little more subcostal, and I'm angling up towards that liver. Breathe. So I have a little bit of kidney. I have the tip, and then I have the dome. So I'm going to take one picture there, and then I'm going to measure. And I'm always going to look at my measurement. We have 16.6 for her liver. All right, so those are my sagittal pictures. Now I'm going to go to my transverse images. So liver transverse left. I'm going to go back to the xiphoid process. This time I'm turning my indicator towards me, so I'm in the transverse plane. Adjust my focus, adjust my depth. All right, take a breath in when you're ready, please. So, just like how we want to sweep every organ, even though, yes, I can see my left lobe here, I'm going to sweep all the way out of it towards the heart. So I'm sweeping superior, and then I'm going to come back into the liver. So as soon as I get to that point, that lateral portion, freeze, breathe. So I swept out of the liver, came back in. I can see the lateral portion of my left lobe. So that's going to be my first transverse image. In this image, we can see stomach here. This is shadowing, this contents within the stomach. Another breath in when you're ready. Our next image is going to include the caudate lobe. So again, I'm looking for that ligamentum venosum that's going to separate the caudate from the left lobe, which is right here. So here's my caudate, here's my IVC, here's my aorta, and this is all my left lobe. I'm going to go live just to show you one more time. Take a breath in, please. So I'm sweeping up out of the liver, come back down. First structure I see is hepatic veins. Then I see my portal vein, and I'm going to try to get to my ligamentum venosum and caudate, which is right here. So I was a little bit more inferior on this patient. Breathe. And then my next image is going to be to include the ligamentum teres with that sonographic shadowing. And in this patient, you can actually see the caudate and the ligamentum teres in one picture. So take another breath in. So again, sweeping all the way up, I come down, here's my hepatic veins, here's my portal vein, and as I sweep out of the portal vein, you can see the ligamentum teres come in here with that shadowing. I'm going to freeze it there, breathe, and you can also see caudate in this image. All right, let's go to the right lobe now. So now I'm going to angle my probe towards the right lobe of the liver. And I know that my first image is going to be hepatic veins, so I'm angling my beam towards the diaphragm. Patient's diaphragm is up here. Remember that the hepatic veins are the first vessels that branch off of that IVC and go towards the right dome. So, adjust my depth and my focus. Take a breath in, please. And then again, I'm going to sweep all the way up towards the diaphragm and then start coming down into the liver. So I'm sweeping inferiorly. And then as soon as I see those hepatic veins pop up, that's our first image. Breathe. My next image will be with portal vein. Another breath in when you're ready. So notice I'm not taking my probe off my patient at any point. Again, I'm going to sweep up towards the dome, come back down. First structures is the hepatic veins. Keep coming more inferior. I'm going to come into the portal vein. Here's portal vein here. So I'm going to make this connect with this. Make those portal veins connect. Breathe. So it's in my right lobe with portal vein picture. I'm going to go live again. When you're ready, take a breath in, please. I'm not going to take a picture here. I just want to show you all. So this is her main portal vein coming into the right portal vein. And then you can see here it's going to branch into the anterior right and the posterior right here. So here's the anterior, and here's the posterior. All right, my next image is going to be the liver and kidney interface. So let your patient breathe. And when you're ready, take another breath in. So I'm still subcostal here. I'm coming down through the liver, and then keep coming inferiorly, because I know that my right kidney is underneath my liver, so keep sweeping down, down, down until you start seeing your kidney come into view. And then if I want to change my window to get a little prettier picture, I'm going to just follow the ribs around. Freeze, breathe. Let's go ahead and, all right, so we can see the right kidney here in axial view, and then here is your liver. So again, here is that potential space right here called Morrison's pouch. And we're comparing the echogenicity of these two organs as well as assessing Morrison's pouch. My next image is going to be the right lobe of the liver in transverse to look at the dome. Take another breath in when you're ready. So I am subcostal and I'm angling towards the diaphragm. I'm going to sweep all the way up, come back down. I can see my hepatic veins and I can see my transverse IVC right here. You can see this round vessel here is my IVC. So this is all my dome. So I'm going to try to get as much of that in as I can. I'm going to sweep my organ all the way out because I want to we're always investigating each organ. And when I like the picture, go ahead and freeze it. All right, so remember, as sonographers, we're not only taking pictures that highlight certain anatomy, but you also have to be looking at each organ for any pathology. Take another breath in. So if I'm scanning this patient, after I take my pictures that I need, I'm gonna not worry about this hand so much, my left hand, and I'm just gonna start moving my probe, sweeping through the organ, assessing it. I'm looking at the parenchyma. I'm looking, is it smooth? Are there any masses? Are there any cysts? I'm not only looking in the organ, I'm looking around the organ. I'm looking outside of the organ. That is our job, is to investigate each organ, look at the vessels, make sure we're not missing anything. So take that time. That's when you can relax this left hand. Go ahead, breathe. And just really take your time. 2 planes. Sweeping, 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 and looking for anything that is out of normal.